Diabetes is an epidemic, and the real issue is there are 89 million of us with prediabetes. So the diabetes that can be prevented, if you want to call it the type 2, is really what the diabetes prevention program is all about. I also have a class that's going on in Caroline County they're almost completed. They're on session 20, and they have very vocal opinions as to how much they did enjoy the program and how much they have changed their lifestyle.
It's been a lifesaver for me. I wanted to lose weight, and this group gives you the tools, and it's not a diet. It's just the way we're supposed to eat. It's a healthy combination of healthy eating and exercise. And if you do it, the weight just comes off and you're healthier, you feel better.
A lot of the group dynamics, the group discussions talk about, I go to McDonald's or I go to Wendy's because I'm so busy, it's just easier to go there. Once you learn what you're eating from tracking, that is one of the things that they do from the very first session is you track everything that you eat throughout the day, and then you total different fat grams and things like that, and you say to yourself, wow, I had no idea that much fat was in that particular food that I was eating.
It takes a lot of thinking, but when you've been heavy and try to lose and you gain instead of lose, you finally hit on something that works. And it's harder once you get older, and once you're pre-diabetic, nothing is easy anymore. And the older really is, I think, a bigger issue. Oh, yeah. That your body is not working like it used to.
7% by session 16. That's the goal.
Oh, by the end of it.
By the 16 weekly sessions.
Oh.
Because the program is for 16 weekly sessions, and then 17, 18, and 19 are every 2 weeks.
Oh, I see.
And then 20 through 25 is monthly, so you don't go backwards.
So between the exercise, which is promoted heavy in this program, and watching your fats, I have lost some pounds, and like I say, my numbers are greatly better than what they were.
So it's really not about those weight goals. It's really about preventing diabetes. And so for that person that has a lot of barriers at home, and maybe the weight is still just not coming, maybe they're having difficulty figuring out that planning of the meal, proper measurements, willpower isn't there, there's no shame at all. That person is supported no matter what.
They did not ask us to do everything we need to do right from the get-go. They focused us on fat grams. And so we tracked and monitored and tried to control our fat grams. Then they said, okay, now add to that paying attention to your calories. And they told us, what is reasonable per day for calories. So we rolled that in. Then a couple weeks later, we rolled in, all right, now you need to pay attention to your activity levels. And here's your goal. You should really have active activity 150 minutes a week. So they didn't teach it all in the beginning and then say, okay, do all these 3 things right now.
But the most important thing is that it's an integrated community health is what the Y is really interested in doing, that you can come and be active and take care of your children, take care of your family, but also take care of your health.